So right now, I would start with management because somebody already has a disease, has to deal with it. So often, if a patient goes to a neurologist, and they know that this is the diagnosis, they will tell you that yes, you have Huntington's disease and you have to deal with it. But the fact is that the patient family has to take care of this patient for the rest of whatever 15, 20, or whatever years that the person is going to live, and has to deal with all the challenges that come with this illness. And therefore, patient management is a very important part of this. So they need help with nutrition, physiotherapy, speech, swallowing, exercise, and in addition, the regular clinical care that they would need for their movements or their psychiatric manifestation that they might have. So patient management comes first. The second thing I would say is that public awareness, that people should be a little more sensitized to feelings of people like this. Often they only have a physical condition, but they are cognitively and mentally quite fine. And therefore, if you were to react very adversely, it hurts them a lot, because finally they are also intelligent human beings like you and me. There's nothing very mentally wrong with them. They are completely fine. So getting over the social stigma is very important. In villages, families have been kind of thrown out of the village because they said there is some spirit that has overcome this family, and it's going to spread into the village and things like that. So uh, illiteracy has its own problems, but it's not as if the literate population has been very nice to them either, because even in an urban situation, they have been ill treated. If they want to get onto a flight, there is a problem. If they want to get into a bus, they have a problem. So these are things that need sensitization. If public awareness improves, policy can be definitely handled. See, the thing is that, for example, if they were to declare that they have a genetic condition, they will not be able to apply for insurance. So even if you're being treated for a fracture, which has nothing to do with Huntington's disease per se, anybody can get a fracture or have to go through a surgery of that kind. That will not be covered by insurance simply because you have declared that you have Huntington's disease. And therefore, people would obviously hesitate to declare that condition because uh, they want to be able to use insurance. So these are some very complex issues that are there. We need some kind of a help line for these people, so that, because they require different kinds of help at different times. So somebody may have a dental problem, somebody has a fracture that needs to be fixed. You can't take an x-ray because the person is moving constantly. So these some of these are very technical problems which an average clinical setup may not be able to deal with. So they need some specialist support of different kinds on and off. So if something like that can be provided, I think their lives would be helped a lot. And not everybody lives in a tier one city. So going to a hospital that can understand the problem and treat is also a problem, because over time these individuals cannot just get into a bus or you know take public transport and keep going for follow-ups. So usually you will see the patient in the initial stages when they are kind of still mobile and they are able to communicate, but as the illness gets worse, they are confined to their homes, and depending on the uh, proactive, or the ability of the caregiver, they will get help or not. So as part of the HDSI, that is the Huntington Disease Society India, this was an organization that we set up on the behest of the families. They said, you've been doing so much in immense, sir, you must come and help us set this up. So it was set up a couple of years ago, and it's now a registered body. So as part of this, we have been trying to have some physical group meetings like a seminar workshop. Some online meetings have happened where we call experts who explain about the illness. So there have been donors who have donated money and said that we can use it to help poor patients who need help, because one is medication, or we travel to the doctor or whatever it may be. So those are some of the activities that we've been doing under HDSI.